Good afternoon, everyone. We'll go ahead and get started. We are recording this just in case it might be of use to anyone later. My name is T. Gonzalez. I serve as the director of the Center for Health Equity, which is a part of the Louisville Metro Department of Public Health and Wellness. And we are heading up this effort, which I think all of you are here to join us for today. This will be pretty informal and brief. Mostly wanted to give an opportunity for you all to be able to ask questions, but I will go through and just kind of highlight some of the important components that we want you all to know about as you are making any proposed applications to our to this granting opportunity to improve access, education, and equity in Louisville's food system. The center has been around for it's almost 16 years now, and we know really consistently one of the major areas of need that we hear about in our community in order to really advance health equity is around our food system. So we were able to secure a larger grant from the Center for Disease Control and Prevention that was being awarded to health departments across the country. And we were able to secure one of those grants here. And as a part of that effort, we have designated $500,000 in order to be granted out, focused on improving or advancing equity in Louisville's food system. So hopefully that's why you've joined us today. Again, it's $500,000. We anticipate that we will be granting out to multiple organizations, though we can't say, we haven't defined that it's going to be 5 awards or 10 awards or anything like that. We're really looking to see what applications we do receive and then be able to go from there. I will say that there maybe is a small chance if we realize any other kind of savings, if you will, in this larger grant, it is possible that some undetermined amount may also be able to go towards this, so above $500,000. But for sure, right now, it will be $500,000 that we'll be granting out. I hope that, and I don't know if Monica or Vicky, one of you, can just make sure to put this link in the chat for everyone. If you're able to access this link, or perhaps you already have, I think a lot of the information here is covered. But we do want to highlight some of what we are particularly talking about for this grant. There's lots of dollars that go, related to food. And this one is specifically geared towards improving food access in our community and addressing our food system. There are some limitations that we'll talk about here in a second about how these funds can be used, because they are coming from a federal source. And so some of that a lot of that gets defined by the federal government, but we'll talk about those in a second. So we really want to focus here on receiving applications of those who have demonstrated a project idea and past commitment to be able to increase equitable opportunity to locating food within our communities, across our community. We know right now that our opportunities to access food and nutritious and affordable quality food in our community is not equally distributed across the Louisville community. And so we want to prioritize projects that are really focused on improving access in the community. And this can happen a number of different ways. It isn't just about the point of where people access food, but there can be places around that's if it's culturally appropriate, looking at ways in which there might be around some production aspect. There's some ways in which there's some kind of business model, whatever that might be. We're looking to support a variety of different ways in which our food system can actually be supported. So I think one of the other questions that we just kind of want to get out there is, I know that many people may be reading, oh, this is out of the Center for Health Equity and it's related to food. Is this granting related in any way to the community grocery store? And the answer for that is it's not. It's only related in the sense that they both might be targeted initiatives towards addressing the Louisville food system. But these dollars are entirely separate. They come from a different source. The Community Grocery Store Initiative is through an ordinance of the Louisville Metro Council. These dollars are, again, from a CDC grant, and it's about our internal process and decision-making around prioritizing the food system. So for that clarity there, these dollars are separate, and while they may intersect in some ways, they are separate. So I want to talk a little bit about, I think, what may be important as you all may be considering what type of proposal to put forward. Again, we're talking about a systems approach here, and we're open to a wide range of ideas, but we do think it's important to highlight for you all here what some of the restricted and then allowable expenses are. So in the restricted column here, you'll see that because these dollars come from the federal government, we can't support lobbying efforts with these dollars. The next one may be a little bit confusing, but I think it's an important point as you all are thinking about what your application may be. Direct food purchases are not eligible to be made with these dollars because of the funding source. So that may be confusing because we're talking about food systems, but we think that there's lots of other opportunities here to support an equitable food system here in Louisville that is not directly about the purchase of food for distribution. So we want to make sure that that's clear. We're not able to fund those types of applications. So just as you get into detailing how your funds would be used in the application form and the budgeting, please know that we'll have to set aside any applications that call for direct food purchases there. But things like paying for certain types of equipment or certain types of either staffing needs or other kind of technical assistance or these types of things, those types of expenses are allowable. So just keep that in mind. We went back and forth with the federal government on this. Unfortunately, we're not able to purchase food producing items such as fruit trees or seeds. So something else to keep in mind. This next component about land purchases, the land purchase is not eligible. We went back and forth with the federal government here that, at the end of, because it's grant funded dollars, and this is the same for certain equipment that we'll talk about next here. There oftentimes, if you're familiar in these kind of granting processes, if certain purchases are made at the end of the grant period, ownership of whatever was purchased, if it's in a certain dollar amount range or certain type of item, would go back to the federal government. And obviously that's not something that we're looking to have happen. So please know that the land purchases are not eligible, as well as equipment purchases of $5,000 or more per item, right? So as you'll see here in the allowable expenses, if it's under $5,000 per item, that is something that we could consider in your application, as well as land leasing. I'm not sure for such a short period of time here whether or not that makes sense, but again, it's your application, and it's something that we can consider. So again, as you're preparing your application, I would just like remind you to look at this restricted and allowable expenses here. If you do have any questions about a specific thing that you're looking to propose, and you need to ask that question about whether or not it would be restricted, please you be able to email us at the same email address that's provided, and we would be able to get you an answer to that question. And we think you have enough weeks ahead of you here to hopefully be able to answer that question in time for you. So again, I would just say, focus on this this restricted and allowable expenses. And thank you, Monica, for putting the email address in the chat there. A little bit more here then about like what our selection criteria. Again, we've defined for you above about food equity and access, what those are above, and understanding that the Center for Health Equity and the Department of Public Health and Wellness are really focused on those communities that would be disproportionately affected by inequities in our food system for this particular initiative. So please be thinking about that. I'm sure there's many resources out there. You can obviously access our health equity report at healthequityreport.com if you have any questions about what communities we might be talking about. But I trust that if you found yourself here, hopefully you're already on that same page. So these are the criteria that our staff will be looking at as they evaluate the applications that we receive. So there's that. Let's take a look at then, hopefully we can take a look at, if you have questions, that was the webpage here. I think we can also put a link into the PDF if that's easier for you to look at in this format. It may be, you'll be able to have that information there. We can also just take a look at what the form here. We hope that we, haven't required so much from you in order to put this, for you to put your application in, some basic information here. I would just say, please, if you have a phone number, and making sure that the person that you list here, we know that oftentimes probably the organizations maybe that are here today, your smaller organizations, often volunteer run. So whoever the best person is, in order to be responsive to when we reach back out, if we have questions about your application, that will be certainly helpful. Again, I talked about, it certainly goes a long way if you can be able to demonstrate, what your organization's experience in dealing with the food system. Obviously, if you haven't necessarily had concentrated, work in the food system area, it does not automatically disqualify you, but certainly it's helpful to think about how your organization is approaching work in addressing equity and advancing equity in the food system area. I think you will have seen in some of the FAQs or some of the detailing about this grant, the nature of the grant and our work here at Louisville Metro Government is that we do want to focus on our residents here in Louisville. So we'll want to see here that the proposal that you're putting forward is focused on Louisville, Jefferson County. And so, in whatever ways you want to detail that, I would put that here. Maybe that's what neighborhoods you're working in, or, if you work countywide, that's great, all of that. But just detailing that, yes, in fact, Louisville Metro residents will be served by the work that you're doing here. These dollars are intended to serve the Louisville community. And then again, through here, it says 250 words max. That doesn't mean you need 250 words in order to detail for us, but whatever ways that you feel like will be helpful in your application to describe for us, how your proposal is really going to, sorry about that, address the food system here. And again, thinking about how we've defined food access and equity in the other part of the webpage there, how it's going to do that, all of that here. And what is your work currently, right? So what is your group currently doing? All of these here, we'll trust that as you're developing, your proposals, you're thinking about, granted it's for a short period of time, but what's your long-term vision for how the work that you're doing today can impact our food system here? Another important component here, I'll just say, and you may say, hey, well, our organization is how the local community can be involved, right? But we would want to see some demonstration here that Louisville residents are engaged in the work that you're doing, and that they also will benefit, just like we kind of discussed a little bit earlier. If you need any support from us, we know that organizations have lots of different capacities and may require different assistance. We want to try to be a good partner in that. So if there's some way that we can be of help to you in the proposal that you're putting forward and carrying out that proposal, please let us know. We're open to having that discussion with you all and being in partnership in that way. A brief proposal timeline here. Again, you're not married necessarily to anything that you put here, except for we do have the deadline for when these projects need to wrap up. But a brief proposal timeline here will be helpful. And then how much funding you're requesting. Again, thinking back to the restrictions that we talked about when it comes to equipment, the dollar amount for per item for equipment here. So if you're saying, I'm just going to throw this out here as an example. If you're saying we're going to buy a refrigerator, right? We would need to know that you're not necessarily buying, let's say, $8,000 refrigerators, right? Individual refrigerators, because at the end of that, it would mean that the federal government needs to own that refrigerator, and that's not going to be helpful to the Louisville community in the long run. So, again, a brief detailing here of your budget overview, and we just want to make sure that what you're including here is not fall into that restricted category that's in the FAQ section. Okay. I think I have briefly run through this, and I'm going to stop sharing my screen here so that we can take questions. I know that probably because most people may not be familiar with WebEx. If you are, you might be able to click next to your name, I think, or look at your name on the participant list and raise your hand. Otherwise, I will just go to the chat here and see. Okay, would you please expand on the type of technical assistance that the center is able to provide? So there may be some opportunities. So we certainly have skills around data analysis, some around policy. It's kind of hard to say. No, we have some planning skill sets for sure. We have, I'll say, I feel like the Center for Health Equity has some really incredible, talented staff. So we have lots of different skills. I think probably depending on what your proposal might be, I think our staff would absolutely be available to help maybe strategize and do some problem solving as those issues come up, maybe in the delivery of your proposal if selected. So that may be, I hope that's helpful. If it's not, Danielle, maybe you could come off mute and just let me know whether or not that's something that you're thinking or not.
That works. I just wanted to understand, yeah, like what would be reasonable to expect if we do ask for assistance.
Sure. So a lot of the core skill sets that I would say that we have is around any policy components, data, coordinating with strategic partners and doing some community engagement, and then just overall kind of planning and documenting. Those are types of things. So we might be able to kind of help in those if depending on what your organization's capacity to do those types of things or know-how and that kind of thing. Let's see. Description. Hi, Andrew. Description of your organization's recent work and experience. Let's see. Oh, okay, so for both of those questions, so there's no word count. I would just say mostly I will say that, I don't think you're getting extra points for longer answers. I will say that a lot of the word count that we've listed here is because we know that organizations are often dealing with, if you have paid staff, it's very time limited, and you're often working with a lot of volunteer-led kind of capacity. So we didn't want to overburden you with the length of these responses. I would say absolutely, if you feel like the documentation of that answer really rounds out like strengthening your application, for sure, be thorough. We just didn't want to overburden people who are often, again, dealing with a lot of volunteer-led capacity for your organizations. I hope that's helpful. Okay, so Anne asked, did you say that staffing is an allowable expense for this grant work, right? So yes, right. So if we could absolutely receive applications that are about, some of you, maybe you're like, hey, we have a particular project around the food system and we're looking to, we've been trying to hire a part-time person for a project that we've been working on that would be really helpful for us. And that's how you're proposing using those dollars. We can absolutely receive that. We also get that because some of the other limitations here, again, I'm not running your organization, so I can't say, what might be most beneficial, but certainly my guess would be that for some of you, offsetting a personnel cost might help you to be able to put those same dollars towards some of your other kind of operating expenses or programmatic expenses, if you could have some dollars to offset personnel cost, right? So that may be a way to think about that. I hope that's helpful. Did I hear you correctly that you may not purchase food for this project? So Nancy, yes, that is correct. Because these dollars come from the federal government, we've received explicit direction from them that direct food purchases are not able to be made with these dollars. Again, recognizing, like I've just mentioned here, as somebody asking about the staffing component, we recognize that maybe funding some other parts of your operational cost, or for an upcoming project or contract worker or things like that, having funding to offset those kinds of costs, may be beneficial to help you with some of the other expenses that your organization heads up. That may be one way to think about the use of these dollars. The next question: are you hoping to give lots of smaller grants or a few bigger ones? We are really open, and we anticipate that we may receive a wide range of asks here. We do anticipate for sure that, we would be granting out to multiple organizations. Now, is that going to be 5 or 10? We don't know. But I think we are looking, I guess we have until the closing date is June 5th to receive applications. So for sure, we are anticipating granting to more than one. So that would be like, it's not going to be the largest dollar amount available out of the 500,000. Again, I'll say that there is a small chance, or it's hard to say with some of these. Again, these dollars coming from a much larger CDC grant that we have. If we do realize any potential savings, then later there may be additional dollars over the $500,000 that we would be granting out. So, but time will tell on the grant. Let's see, Elizabeth, are religious organizations permitted to apply if the project is not for religious purposes? Are schools permitted to apply? I work for an all-girls Catholic school. That is a really good question, Elizabeth. I am not sure that I know the answer to that. Could we get an answer? How about this? We will record that question and get that to you. Mostly for me, I don't know whether or not there would be any restrictions from the CDC on this, but that's something that I could ask our program officer about. So maybe if you can, I don't know if you have access in the, or if you want to, if you have access in the chat, Elizabeth, to either send to myself or to Monica Leslie, who's listed here as one of the participants. You can privately message one of us your email address, and we could follow up on that question for you, and then we'll figure out a way to kind of post the answer to that on the frequently asked questions pages of the website as well. Is there a grant range? There isn't. All we can say is that we anticipate that we for sure will grant to more than one organization. So it won't be $500,000 to one organization. So Susan, I know maybe that's not helpful, but I would say you should put in your proposal, what it is that you need, and maybe use that budget box at the very end to break down the types of costs that you're looking at there, and the uses that could help us, kind of determine how what we're going to be able to fund given the number of applications and the applications that kind of meet that systems focus that's really about improving and advancing equity in the rural food system. Yeah, also a good question. What's the reporting requirements here? Obviously, we have to report, we will have a staff person who will be coordinating with those that are awarded around those reporting requirements. So certainly if you're having any purchases or those types of things, we will have some reporting requirements, because we're going to be required to give that back to the CDC. So they'll want to see demonstration of how we do that. And we will have a staff person who's the connector point between those who have been awarded and the Department of Public Health and Wellness. What about purchasing small equipment for participants? Nancy, I wonder if you can tell me, is that like, can you detail for me what types of equipment you might be talking about? I don't know if you're able to come off mute, Nancy. Well, maybe they are not able to come off mute. So, small equipment, again, I think I mentioned earlier, let's just go with the same example here of a refrigerator. Um, uh, that would be an allowable expense so long as it is under that $5,000 per item mark. And again, at the $5,000 mark, it just like triggers this other process with the federal government that we think is not going to be helpful to our community. So, and being able to keep the ownership of that equipment here in the community. So, we can talk about again individual items if anybody has questions about that. But otherwise, then yes, you can, so long as it meets under that threshold, that financial threshold. Let's see. Can we apply this? So again, this is just part of um, uh, a one-time grant for us as the Department of Public Health and Wellness at the Center for Health Equity. And we are using a portion of that grant to grant out related to the food system. So at this point, it's a one-time opportunity. Whether or not there will, for those that we've been through a bit here as a public health department and the public health, the types of initiatives that are being funded right now for local health departments to be supporting in their communities is a wide range of things right now. So I can't speak to what the future will hold. We are aware that new funding opportunities are opening up all the time related to public health, given the moment that we're in COVID. And where we have been in the past 2 years. So I would just say, I don't know what the future will hold necessarily around this type of funding opportunity. So for right now, kind of a one-time thing out of this larger CDC grant that we have as a public health department. Do you or other parts of the...
May I
Yeah,
expand
sure.
on that question?
Sure.
So could we apply, for example, for 10,000 over 2 years in that one application, or do you mean to fund projects that will be completed in the 1 year period for which you have
Right.
funding?
So at this point, our it's at this point, this CDC grant, we will end that as it stands now. The end date for that grant is June of next year, right? It is possible that we will, for those in the grant world, that we will have like a no cost extension there. I just don't want to speak to that at this point because that hasn't been finalized for us. So if that happens, you could have some additional time for spending. But I would say, Danielle, it's if what you're really looking at is a need for $20,000, then I would make your application for $20,000, given the June of 2023 current deadline as it exists for utilizing dollars. Does that make sense?
Yes, it does. Thank you.
Okay. Let's see. Do you or other parts of the health department anticipate having an RFA this year for health equity work from ARP funds? No, I don't think so. I can't. I'm trying to think in the moment. No, I think that is probably not the way that ARP funds are like coming into are being utilized by departments, or being like allocated necessarily for the type of work. A lot of that is happening, obviously, through the mayor's office and then what gets funneled through the Metro Council. So I don't anticipate ARP specific funds at this time. Okay, and then Elizabeth asks, I'm a bit confused about the fridge example. Is it that we can't purchase a fridge if it's $8,000, or that we can purchase the fridge, but only 4,000 of it would be paid for by the grant, right? So using the fridge example, the actual item itself here, the example, the item itself needs to be under a value of $5,000, right? When it comes to equipment purchases. Over the $5,000 amount, as we've been kind of informed by our grant officer, in our reporting, purchase of equipment over the $5,000 mark is going to require some other processes and potentially ownership by the federal government at the end of the grant period that we do not think is going to be helpful for this community. We don't want you, again, using the fridge example, to purchase a fridge for use that in June of 2023 is then going to be owned by the federal government. I think we can all understand that won't be helpful. So I hope that is helpful information. So the individual item needs to be under $5,000. I think that is all the questions that I see. Are there any other questions either in the chat or if anybody wants to come off mute?
Yeah, I was going to write it, but yeah, just on that example of you all needing to expend the dollars by June 2023, I wonder if giving the grant counts as that, for meeting that deadline, and whether the grant period for us, as potential subawardees, could go longer than that. Or do you all need us to have spent everything also by June?
I feel more confident that it needs to be, that the dollars need to be spent by the organizations by June of 2023. So again, but two things there. One, I can absolutely clarify. I will absolutely clarify that and to make sure that that's the case from our grant officer. Then two, the nature of this grant, it is very likely that we will apply for a no-cost extension. And in the event that we do that and it's granted and we feel assured that it would be, that would then extend for grantees here to have longer to expend those dollars. Well, again, we want to remind everyone, hopefully you grabbed those links in the chat. I want to thank my colleagues, Monica Leslie and Vicki Caldwell, who are on the call here for helping to put this together and all the information that you see on the website. If you have any questions for us, please give us a call at 574-6616. Or you can reach us at the email that was put in the chat. It's healthequity@louisvilleky.gov. That's another way to reach us. We do want to make sure that we get your questions answered before the deadline. And again, the deadline being June 5th. I believe that is a Sunday. So you still have a number of weeks here. We want to make sure that we're trying to be as helpful as possible in getting your applications in. So please do reach out if you have any questions. And we very much look forward to receiving your applications. Thanks so much for coming today.